Well, good afternoon, everyone. Welcome. My name is Amy Delamade, and I'm excited to welcome you to today's CanCare Renewal Stakeholder Feedback Forum. Thank you all for coming out this afternoon. We appreciate your time, and we hope to make good use of it. My name is Amy Delamade, and I'm a facilitator from Wichita State University. I'm here with a team of facilitators from the Community Engagement Institute, and our role today is to support the state in providing you with information about the CanCare renewal process and some potential changes they're considering. And we're also here to support you in providing your input and feedback to the state about those potential changes. So you might have been greeted by Anne and Vanessa when you came in today, and they're part of our team. They can help you with anything throughout the day that would help make this meeting more comfortable for you. We also have a couple of students here with us today, and they'll be helping us by taking notes and being available as well. So do let us know what we can help to make this a comfortable meeting for you, and we also want to help ensure a high-quality participation process for you. So let us know what we can do to support that. Well, the purpose of this meeting is for the state of Kansas to share with you information about the CanCare renewal process, and for this staff at the Kansas Department of Health and Environment to share updates about potential program changes and to provide you with some questions for consideration. They also are really interested in your feedback, and so we'll provide opportunities today for you to talk at your tables and to share some feedback in a written form and to also call out some feedback to the large group. As an important note for today, these changes that will be discussed are just potential changes at this point. They're proposed. There's nothing definite yet, and so we want to encourage you not to change your life or your programs in response to what you hear today. The state will let you know once changes are final and what the results of those are and what action you'll need to take at that point. But for today we're in brainstorm, thinking, sharing mode about some potential changes. So a little bit about the format for today. I'll provide some introductory remarks about our format and our session together, and then Mr. Mike Randall from the Kansas Department of Health and Environment will share some background and context about the CanCare renewal process. Then we'll hear from Mike about 3 different topic areas, and after he shares a little bit about each topic, you'll have time to talk at your tables, to take notes on the flip chart pages, and to discuss at your table what you would like to call out from your conversation. And then we'll take large group call outs, going really just one table at a time. So not every table will get to call out for every topic area just because we're a large group today, but we do hope to hear from every table at least once to get a general feel for the conversations that you've had. And then what Wichita State University will do is take anything that's written on a flip chart page, and we will include that in our report, as well as a typed up version of the comments that we hear spoken out loud. We'll take all of those and put them into our report that we share back to the state of Kansas so that they have gotten good feedback and input from you all in the process. Let me share with you a little bit about the handouts that are on your table. So you might have heard when you came in that there's a green sign-in sheet. If you would please make sure everybody at your tables had a chance to sign in, that would be very helpful. The information that you share will be shared back to the state in a format that's easy for them to use so that they can include you on future information and updates about the CanCare renewal process. Another handout you have is a half sheet of blue paper. These will be some of the questions we invite you to discuss about each topic we present today. A handout that you don't have at your table because we didn't have copies available, I apologize, but that I wanted to make sure you know about is the CanCare Ombudsman program. Has anybody in this room had a chance to call the CanCare Ombudsman before? Cool, we've got a few hands, thank you. So that phone number is 1-855 643-8180, and I'll say it again in just a minute. The CanCare Ombudsman is a great person to call to get a little bit of personalized help. So you might be experiencing a situation where you're stuck or frustrated or not sure what to do next about your personal experience, and the CanCare Ombudsman's office can help you through that. So that phone number again is 1-855 643-8180. And the CanCare Ombudsman might have a representative here today, and if she does, give me a shout. But if not, that phone number is a helpful resource for you. Another handout at your table is a white half sheet that's a save the date. In about 3 weeks, for anybody in the room receiving long-term supports and services under the home and community-based services waivers, which are like IDD, physical disability, frail elderly, in about 3 weeks in June, we will have another set of information sessions about the HCBS settings final rule. And that relates to a rule that came down a couple of years ago about making sure that settings in the home or the community are truly home and community based. And if you're interested in that, we'd love to invite you to attend those meetings. Finally, I'm holding a marker because every table should have a marker. Might be a different color than brown, and that'll be your tool for writing on the flip chart pages when we have our conversation time. And one last handout for you. It's the blue and white one. The PowerPoint presentation that Mike will go through in just a little bit covers a lot of the points that are also covered in this nice one-page handout. So when you're trying to read the small print on the screen for the chart, you can take a look at it on this handout as well. It'll be the same one. And then there's the nice boxes on the back with the timeline and a little bit about the potential improvements or changes we'll be talking about today. I want to highlight the second page at the bottom of this handout. There are additional stakeholder feedback forums going on today in Kansas City and Wichita. We'll also have one at 5:30 in both Kansas City and Wichita today. And then tomorrow we'll be in Hayes and Pittsburgh, also at 1 p.m. and 5:30. So those additional times are listed there. And then at the bottom of the blue column on the left, there's an address for CanCare renewal at kdheks.gov. And that's a resource for you if you go home after this meeting and you think, you know, what I did not tell them was something very important. You can send that in an email to that email address, and the state of Kansas will be able to take your input and feedback that way. So we wanted to create a route for you to get in those ideas that you might have forget about in this meeting, but that you think about later on. And just one last note, if you would like any of those, if you would like this handout in particular in Spanish, large print, or Braille, we have those versions available as well, and you can just check with Vanessa or Anne in the lobby. Okay, I think I have just a couple of other items. The PowerPoint and handouts will be available online on the cancare.ks.gov website in a couple of weeks, as well as the responses that the state puts up at that time to your questions. Also, you might notice there's a video camera in front of me. The state is videoing this session, and they videoed a session yesterday, and that's for the benefit of people who aren't able to attend in person, and that video will be posted online as well. So just as a heads up, when we're doing our large group call-outs, the video recorder person will be walking around with the camera and recording your responses. Just wanted to let you know so you weren't surprised when that came around. If you have your cell phone, will you please make sure to put it on silent or vibrate? The restrooms are located out these doors and to the left, and the refreshments are available in the lobby. And with that, I will turn it over to Mr. Mike Randall. He's the Director of the Division for Healthcare Finance. Please join me in welcoming Mike.
Thanks, Amy. Thank you, everyone. On behalf of the Kansas Department of Health and Environment and the Kansas Department of Aging and Disability Services, I want to welcome you here today, and we really do appreciate your time and taking the effort to come out and be with us this afternoon. As we get started here, I want to kind of give a little context as far as why we're here. There were a couple of options we could have had with respect to how we wanted to get this feedback. Some information we received from last night's session is maybe there wasn't enough detail within some of these potential changes. That really is by design, in the sense that, you know, we could have designed the changes, we could have written the renewal, and then we could have presented that to you. But we chose not to do that. We chose to have these sessions and get feedback from you prior to writing that renewal. So that's why the potential changes that we'll talk about today, not a lot of detail. That's why we're here to have you provide some of your ideas and thoughts with respect to that. As I've said, this waiver is not written at this point. These meetings are for gathering that information from members, providers. I think Amy mentioned there's about 10 meetings across the state. This is the second day. I'll be out again tomorrow. We will be holding additional meetings throughout the summer as we finalize the draft and renewal process, so that will actually be publicized well so that you can attend those sessions as well. And there were frequently asked questions, as Amy alluded to, from these sessions will be posted on our CanCare website and will be updated. So really from a CanCare time to renew, when we take a look at CanCare, it actually started on January 1st of 2013. It was a 5-year-long demonstration period. Our plan is going to be submit the renewal application by the end of this year with the effective date of 1/1/2018. Currently in CanCare is an 1115 demonstration project. Really all 1115 means it's the section within the Social Security law or the act that provides the authority for this particular waiver. What we do, the 1115, it really provides the greatest flexibility for us to provide the services to our members. You can also see as we went into CanCare in 2013, we brought about 95% of the population and services within CanCare. Ultimately, our goal is to achieve what we call the triple aim within healthcare. So you want better care or an experience for your member, you want better health for the population as a whole, and you want to reduce the per capita cost of healthcare. And you can kind of see the goals when we're talking about breaking down those silos of care, improving the quality and the outcomes, and really increasing the emphasis on health and wellness and that prevention activity. You'll see the current CanCare beneficiaries. We have children, pregnant women, individuals with disabilities, technology-assisted children, kids with autism, frail elderly, able-bodied parents, caretakers under 38% of the federal poverty level, individuals with traumatic brain injury, individuals with severe emotional disturbance, individuals with breast and cervical cancer, individuals with tuberculosis, and individuals with HIV and AIDS. Some of the benefits with CanCare as we went in 2013, there were some additional services added. So there was bariatric surgery, heart-lung transplants were also added to the list of services that would be provided within CanCare. Additionally, each MCO is allowed to provide what we call value-added services, and you can kind of see those value-added services. And so for the last 3 years, the total of those value-added services is almost $15 million in providing those services to our members. Now, the value-added services really vary depending on the MCO, but it would be like adult dental, it could be smoking cessation, additional respite care, and those types of things. One of the things when we look at when we have CanCare is prior to 2013, we took a look at the sustainability of the costs as they were rising. They were simply rising at too high of a level. This chart illustrates where I believe we've been successful with CanCare in kind of reducing that cost curve while at the same time maintaining the membership and the services that we provide to those members. So if you look at the top line, in 2012, prior to CanCare, this was with our projection if we did not go to CanCare. You can kind of see the trajectory of that line. The middle line is in 2012 is our CanCare projection. So back in 2012, this is what we projected the cost would be in CanCare. And that bottom line, you can actually see that's where we actually are today with our costs. So we have successfully, reduced that increase in those costs at the same time maintaining those services to our members. Next, this is really a slide that kind of shows our Medicaid cost by population. You can see children and family, individuals with disabilities, elderly, Medicare, and other. One thing I want to highlight on here, if you take a look at the slide from state fiscal year 2013 and you move to 2015, you don't see a reduction in that investment in Medicaid funding. It's increased each year. I will also say that when you take a look at children and families, they comprise about 2/3 of our population, and they only use about 1/3 of the cost. It's the inverse for elderly and disabled. They are about 1/3 of our population, but they consume about 2/3 of the cost. This slide really illustrates, I think, where we have the success in CanCare and what we've seen. This is one of those performance metrics or performance things that we look at KDHE and KDADS as we take a look at utilization. So we go back to 2012, and we want to see what the utilization was for these categories of service, and then we take a look at where we are now. When you go to a managed care environment, you would expect to see certain things. You would expect to see a decrease in your emergency room utilization. We see that. You would expect to see a decrease in your inpatient. We see that. You would expect to see an increase in your primary care physician because you had that care coordination. We see that. We see the increase in transportation. We see the increase in HCBS services with respect to those services being provided. So this, again, is one of those metrics where we believe we have been successful with CanCare. Now, with respect to the CanCare renewal process, this, and I think you have this handout on your table, if I'm correct. We're conducting these renewal stakeholder forums right now through May. We'll finish that tomorrow. We'll develop a draft of the renewal application. That'll be June, July of this year. We'll post application for review and tribal consultation toward the end of the summer, beginning of the fall. The renewal application will be submitted to CMS at the end of this year, 2016, around November. We'll have CMS public notices and consultation with state throughout 2017. Because remember, the demonstration period ends December 31st of 2017, but we have to apply for the renewal 1 year in advance. So that's why we're going through this process now. And as we go through those public notices and consultation with the state, we'll again have stakeholder engagement meetings as we go through that process. Then CMS decision, and we'll have our special terms and conditions, which is really our contract with CMS, is how we move forward with the program. That will be December 31st, 2017. So what are some of the potential changes we're looking at? You can see on the slide here, we're looking at continued improvement in our care coordination for our members. Payment, not based on fee for service, but payment based on outcomes and values, how we can do that. And then we're also looking at waiver integration. So coordination, integration of care, when we renew the program, we want to make sure that we ensure that care coordination is effective for our membership. It increases the integration of care for the member. We really want to make sure we clarify the role between the MCO and the community providers. That's an extremely important thing. We don't want to duplicate services. When we duplicate services, we restrict access to those resources. We could be providing those resources to other individuals potentially in services. And we want to be flexible where we can. So as we go through this tabletop exercise, and I think Amy may be joining me or will be coming up here in a moment, here are some of the questions that we'd like you to consider. What should be the key features of the care coordination relationship with the members? How should we measure the effectiveness of care coordination? How do we know it's being effective? So what are those specific measures that you want us to look at? What are we missing today in care coordination, if anything? And really, anything else that you would want us to change or keep the same, we would like to hear that as well. So now I'll turn it over to Amy, and we'll have our first tabletop exercise. Thanks.
All right, so this is our first topic. We're talking about continued improvement in coordination and integration of care. What I would like for you to do at your table is identify somebody who will take notes. That person will be our recorder. And identify somebody at your table who's willing to call out to the large group. That'll be your reporter. So you'll have a recorder and a reporter. And you'll use your marker and your flip chart page to take notes. And then have a conversation about these questions. I'm going to leave these on the screen for you. You also have your half sheet of blue questions there, and those questions sound like this. What changes involving the coordination or integration of care would most interest you? What would you like the state to keep in mind as it considers this potential change? And what questions or comments do you have about this issue? So you have your choice of these questions or those questions, so 7 altogether. If you would like to have a focused conversation at your table, I recommend picking one of these questions that's interesting to you and talking about that one. You'll have about 10 minutes, so that's not a lot of time to talk about 7 questions, which is why I suggest picking one that you think is most interesting to discuss. When we're done having that time to discuss at your table, we'll hear from about 1/3 of the room, and we'll call out just one idea per table. And the call out will be, what question did you talk about, and what was one of the things that you talked about in relationship to that question. Does that sound all right? One question and one call out about what you discussed relating to that question. So take about 10 minutes now to have a good conversation at your table. We're going to start at the front, my left side of the room, and my 2 colleagues, Anne and Vanessa, are going to bring microphones to each table one at a time. And we'd like to hear two things from each table. We'd like to hear first what question you discussed, and we'd like to hear second one idea that you talked about in response to that question. Just one, if you will. And if you hear something that's quite similar to the one idea that you were going to call out, that's your chance to call out a different idea. So that way we'll get out into the room a few different ideas, and that way we don't have to hear the same ones over again, but we can hear lots of different ideas. How's that sound? Good? Good. Okay. So Vanessa, what question did your group address, and what idea did you talk about?
Yeah, our group, ooh, that was loud. Our group addressed number 2, which was, what would you like the state to keep in mind as it considers potential program changes? I think really what we boiled it down to is we were certainly interested in a lot of the ideas of improving the program, getting more creative with a lot of the different models, reimbursement, whatever. But I think the biggest thing for us and for the specific TA waiver HCBS population that we focus on is making sure that the authorization and reimbursement models that are out there, whether it's movement away from fee-for-service, looking at different options, open to some of those, but certainly want to make sure that it keeps in consideration what are the real needs of consumers and participants out there and providers. There's shortages in staffing across the state, across multiple states. All right, there's difficulties. Reimbursement models haven't changed in Kansas since 2008 for our population. Cost of business to provide the service has gone up. It's an untenable situation, and participants aren't going to get the help they need, no matter how creative the program is, if we can't find qualified staff to provide the service. So we have to look at that.
So two key ideas there. I hear you talking about keeping the person served at the core of the services and keeping that person's needs in mind, and also being aware of providers and what they need and making sure that their needs are met.
Right, yeah, I can boil it down to just balancing outcomes, because we're all interested in better outcomes for everybody, for the participants, for providers, for payers, everybody.
Okay.
But you got to balance that with other things.
And that could be really useful as we think about continuing to improve care coordination. So let's move to the next table. What question did you discuss about continuing improvement in coordination and integration of care?
We're also interested in how the state will be able to manage changes and to be efficient. And specifically, we talked a lot about the new call center and the amount of time that it's taking for adjustments to be made. They're lagging somewhere between 6 and 9 months behind. And there's a loan program that's happening right now due to the fact that those adjustments are taking such a long period. Call times are currently 1 hour hold when you call. You're only limited to one question allowed, and they hang up on you, and you get to call back again.
Okay, so could you tie this to me for me to improve care coordination? Did you guys get a chance to talk about that
In order
part?
to improve the care, the individual has to be paid. So they had a system in place before that worked very well, and it was canceled, and the new call center was created. So perhaps simply going back to the old system where they had multiple offices through the state. And the thing that also...
Okay, so I hear some agreement in the room for that idea. Thank you.
This is a major problem. The other...
Well, thank you for tying that back to care coordination for me. I really appreciate it.
Then the other one
Okay,
is...
you got a chance to just tell your one idea. If we can share that next time around. All right. Anything that you guys get written down on your flip chart pages will be included in our report. So we'll hear a call out from the third table here. Tell us what question you addressed.
Well, actually, I was kind of wishing I could look at theirs, because ours also had to do with care coordination, feeling like it's very much lacking. The severe systemic delays in application process, which then delays the services for months because people are not getting the application process in a timely manner, so the services are being delayed. Again, I would talk about the call center process. We've had personal experience where we're on hold for 2 to 4 hours and never get through, and the person on the other end really not knowledgeable about what they're talking about or what the information is that they're giving.
Okay, so reiterating the need for the clearinghouse to be timely and shorter call times would be helpful there.
Yeah,
Right.
and we
Okay.
would also second the,
Thank you.
we've noticed that since the move centralized to Topeka.
Okay, thank you so much. Let's go to the fourth table now. Let us know what question you addressed and how that would help us think about improvement in care coordination and integration of care.
We addressed what are we missing in care coordination, and our discussion focused on the care coordinators that know the populations they are working with.
Great.
In reference to their locations sometimes are very far away from their caseload person and difficulty getting with that person personally.
Thank you so much for that comment and recommending that care coordinators be a little bit closer to the populations that they're serving and specializing in that population. All right, next table. What's something you talked about? What question did you address?
My question is, what changes in the area that are most important to me? Well, first of all, QMB and my spend down. That is so complicated to me because the hospitals don't know anything about QMB. You bring it up to them, I got a QMB that covers, which is supposed to cover after Medicare and Medicaid, and the QMB is supposed to cover. You bring you tell the hospital about it, they don't know a thing about it, and they put it in the file.
Okay.
And that's what I want to know. Why do they put it in the file?
Okay. Thank you for that helpful input. So a smoother process for the spend down and more information to providers about that sounds like it would help improve your care. Thank you. Okay, next table. What question did you address?
We kind of talked about a general care coordination and how we learn about new opportunities as things get rolled out, how those get streamlined, how education goes out, and what kind of outreach there would be, and accessibility to new services.
Okay, so did you have suggestions for improvement in any of those areas or one of them?
Well, I think what we looked at was we all come from different areas and had different interests at the tables, but what the common theme was that how are services not disrupted? And so when CanCare changes are made, how are we going to, it's difficult to access a system, it's difficult to know what your provider actually offers, and how are we going to improve that education to the individual so that services for them or their family member are not disrupted.
Oh, so two important things there I hear is communication about what services are available and making sure that care isn't disrupted as changes occur. Thank you so much for that helpful input. Okay, next table. What question did you discuss and what are some of your responses?
We looked at the question number 3. What questions should we consider as we move forward, or comments do you have? And on the CanCare handout that we got, it discusses strengthening supports for members to obtain and maintain competitive, integrated employment. Well, this raises concerns for us in regard to possible reduction in funding of the clients. There are 5 to 7 year waiting periods in some places of the state today, and these lists are just too long. In addition, where are the jobs coming from that they talk about? Kansas has no job growth, as you all know. You read the papers like I do. And then the next question is, how is the training of these people going to be determined? Where are they going to go for this training? What kind of training are we talking about? It's better to have all the specifics before we launch a new program or do something.
Okay, so I hear from your table real importance on that job and work piece, and thank you for sharing what's important to you about that. All right, next table.
The question at this table that they had was basically the communication they can receive to families and to themselves when it comes to their annuals versus semi-annuals. I guess there's been some spin down questions and how often they've been receiving them, along with having staff being trained to answer their questions.
Okay, so some questions about communication to families and participants, questions about spend down, and what was the third area? Education? Okay, educating of the people answering the phones to the family to know what to do. Okay, thank you for those important thoughts. Okay, next table, what question did you address and what was one of your responses?
We addressed what is currently missing in care coordination today, and we've heard a lot of the same common themes, timeliness of responses, but what would be helpful in addition to that is a clear chain of command and how to go up that chain of command if you're not getting a response after weeks and months.
Okay, so good recommendation there to clarify where you can go up the chain of command to get a response. Okay, how about the next table? What question did you discuss?
We discussed collaboration between doctor and hospital and nursing home. And then also, I read in the paper about Medica, and we need information about that.
Okay, so question about Medica. I'm afraid I haven't heard about that myself, but thank you for noting that as a question, and also the importance of collaboration between doctors and hospital and nursing home. Very good. Okay, next table. What question did you address?
Hello. Our table pretty much discussed a lot of what has been covered. But one thing, initially, when you apply, your husband's in a nursing home, you apply. 6 months later, you've not heard a thing. So at that point, when you apply, someone should contact you and say, we've received your application, whether it's text, whether it's email, or whether it's a phone call. We've received your application, you can expect it to be done in such and such a time. And that way,
So I hear lots of support
Thank
for
you.
that idea. You'd like to get some feedback once you submit an application to know how long it'll take to process.
right, family members are frail, it's a bad time,
Sure.
they need that.
Okay, thank you for that helpful suggestion. Okay, I think we have one more table for this round of callouts. What question did you address?
We addressed number one, the changes in what changes in the area would be most interest. First of all, I've got to say communication is not, I'm more frustrated with that than anything, but everybody's discussed that. But the change I had was once you're in the system, there's a renewal process we're getting every year. It's a booklet of however many pages. My mother has had absolutely no changes in income, status, anything. It's taken hours and whatever. This last year I actually got 2 forms to fill out at different times for approval. And that could be simplified with a single sheet of paper, an affidavit saying, hey, there's been no changes in their status.
Okay. Thank you for that comment and suggestion for simplifying the process of renewing an individual's insurance each year. Okay. Hey, thank you all for your thoughtful comments and responses. This concludes our call out for our first topic. So I'll invite Mike up again to talk about our second topic, outcomes-driven payment.